welcome Wakefield to our bi-weekly COVID update. We have our esteemed panel here this morning to give you an update on what's going on in COVID. And there's a lot of stuff going on. And I've been talking to a lot of people, and I got to say that, even though the numbers are creeping up, and they are, and we'll talk about that shortly, we are better equipped than we were before to deal with it. So please, there's things that you can do. If you're not vaccinated, get vaccinated, number one. We can't stress that enough. If you're vaccinated, get your booster shot, number two. Get tested, number three. And number four, you know what? If you're in a group and you feel that you are, even though there may not be a requirement, please, this is still when you add all those things on, this certainly helps. So, I just can't stress it enough. Keep doing what we're doing, and let's just keep being safe and be smart. So I'm going to turn this over to our chair of the town council, Julie Smith Galvin, who has been so supportive of all our efforts and in this manner, and can speak from experience to keep this on even when others don't. Right, Julie?
Exactly. So I don't want to take a lot of time. I want to hear from the experts, but I second everything you said, Steve. I have two kids coming home from college this week. It's a whole new ball game. I'm very thankful for the clinic on Monday. I have three, my husband and my two kids signed up for that. I think it's critical, and absolutely there's no shame in wearing a mask. I was in some situations this week where I was one of the only ones doing it, but that's my comfort level. And somebody said on this call at some point, if you feel like you should, you should. Like, if you feel nervous, you should do it. And that's how I was feeling. So I'm going to get to the experts. Thank you all for everything you're doing. Have a wonderful holiday season. And I know we are in good hands as we keep up this fight.
Thank you. Thank you, Julie. I'm going to put it right over to Melissa Lowry, who is all things health this morning for us. So our public health nurse, who is way overworked right now. But thank you for joining us.
Thank you, Steve. I'm standing in for Anthony, who is the director of the Board of Health, and I monitor the COVID statistics for him. And I don't know how in depth that we usually go with these cases, but since the beginning of when we've been tracking COVID, we've had over 3,600 cases. We currently have 243 active cases. That is a record. We had one death this week, an 85-year-old, and we've had a death pretty much every few weeks recently. And actually 3,300 have recovered. In the work I do in contact tracing, there were 135 cases in Wakefield this past week, and it's just been climbing every week for at least the last month or so. And I looked back, and we are almost at the levels we were last December and January, where people were reporting in almost 140 cases a week. So the levels are high. And so the only thing that we can do is really to do exactly what you said, Steve. Get vaccinated, get your boosters, wear masks when you're out and about in the community. Try to social distancing when you're away from intimate family where you know that you've been together. And also, do get tested. There are more rapid tests out on the market where if you're going to be going someplace, you can take a test ahead of time and have somewhat of a comfort level that you do not currently have the virus if you're going to be with other people. One little plug I'd like to put in for the contact tracers is, if you do test positive on a home test, please go get a PCR test. That would be one from a doctor's office, an urgent care, or one of the Stop the Spread drive-through locations. That is the way that the lab results get into the system, so you can be contacted by a tracer, and we can try to help stop the spread of COVID through contact tracing. Does anybody have any questions or any additional requests?
I know that Doug is not on this morning. I don't see the panel, and I'm sure he has a lot of other things going on over there.
Doug's on.
Oh, Doug's on. Okay, I didn't see him come in. I did want to hear where we were with the schools. Thank you, Julie. Oh, there he is, Doug. Why don't I go to Doug? Any update on the school section? We can go back to Melissa.
Absolutely. Good morning, everybody. Our numbers have increased proportionally as they have across the state. And so currently this week we have 67 positive cases. And so we have 57 students and 10 faculty members, along with 147 in quarantine. We have 146 students and 1 faculty member in quarantine. So our numbers are really increasing dramatically. We're seeing an increase, also an increase in test and stay. This week, we'll test close to 300 students in test and stay, or I should be clear about that. We will administer near 300 tests, which account for about 220 students being able to stay in school. Of all the tests that we have administered in our test and stay program, again, of close to 300, that has resulted in 4 positive cases that we have been able to kind of detect and also kind of get those students to a safer space and also kind of protect our school enrollments as well. And so our resources, our school nurses are really stretched. We're also having a new certified nursing assistant that is joining us to help support testing through the CIC program. And so that's assigned through the state. So that's where we are at. There's also an increased demand, and I've been talking with Anthony Choi about this, as well as the Department of Elementary and Secondary Ed. There's an increased demand and an ask for testing availability because all of the sites in our local area are particularly stressed right now as well. So we're working on a number of things there to try to help support the demand there. So that's a very quick update.
All right, and we're certainly here to support in all those efforts, Doug, as we go forward. So thank you very much. Thank you. And I think that test and stay program, what a huge difference in keeping our kids in school, and not only that, but stopping the spread or slowing it down.
Absolutely.
Great job. Wonderful. Melissa, did you have anything else to add before I go around, or are you good for now?
On the actual clinic numbers, no, but I could put in a pitch for the clinic whenever you have time.
Okay, absolutely. Why don't we talk a little bit about the clinic that we just had before I go around? We had the 5 to 11-year-old clinics, and I got to say, what a wonderful experience to have been there on both days. And I think, and when you look at our numbers on percentage of that population that is fully vaccinated, we're up around 50% there, which it was nothing, a few weeks ago. So really, the great happy families getting these kids ready for safer for the holidays. Thrilled to be part of it, and kudos to the health department for putting that on. Great job. Speaking of the health department, let's our health board anyway. Laurel's already unmuted. We'll go to Laurel. Ready to go.
Just because it's a quote of the year. So good morning. Kudos to everybody who helped in that clinic. It was a well-oiled machine. Again, nothing like having officers from WPD doing, and Sammy, like incredibly helpful.
Really, Sammy, incredibly helpful.
I know. Well, no, I mean, I have to say, and I said this in our Board of Health meeting, we always learn something. I've been in this game a long time, and there were some ways that our professionals manage situations that I will borrow. Officer Kelly was amazing with how she can engage with kids and distract them. And in pediatrics, it's all about distraction. And for anyone who thinks that we kind of I have a belief in pediatrics that it's the anxiety, not the actual test, not the actual jab that is so difficult. And so we had a couple of kids who had a very difficult time on round 1 who were really well prepared on round 2. And I had one kid who marched in, looked for me. She became my private patient. No fuss. She was very proud of herself, colored a picture for me. You know, her first visit took like 2 hours. This one took 15 minutes. And it, you know, it just was a testament to good parenting, and that kids can do this. We will support them. And so I'm hoping that we don't have to use our same pediatric skills on Monday in the adult clinic, but sometimes we do. We do have people out there with fear factors, but where we are well versed, we will support everybody on Monday, and the timing is excellent, as Julie shared, for the college kids. I've already fielded some calls like, oh my God, where can I get this? Because everything really is filling up. So it's nice about these community clinics that we can't sustain them all the time. When we can do them, we really get a chunk of work done. So, you know, as evidenced by the pediatric demographics that, you know, went from 0 to 50%, you know, we got half the kids. Right. In a 2-day shot. So that's what we do in public health. And so please be safe. I echo, I was just talking to a family member who's going to pre-test before a gathering. And I said, you know, you can wear a mask in between eating and drinking. Just, you know, keep that personal space. Very New England.
Yeah, exactly.
And
fences make good neighbors. Masks make good neighbors, as do fences, maybe.
I know. So good luck, everybody. Stay well and keep up the good work.
Excellent. Elaine Silver, are you on with us?
I am. I'm still here.
Perfect. Elaine, who has been handling so much, including our contact, really working with our contact tracing. Anything you want to add today, Elaine?
Just really to remind people, as we've said with the mask, just wear it. There's nothing wrong with it. I did it myself this week, and it doesn't matter. It makes you, it's a comfort zone and it's a protection level. And I do want to ask people and remind them, as Melissa said, if you do a home test and that home test is positive, please go get that PCR right away so we can get that result. And when the contact tracers call you, I know it's a busy time of year and some days you don't feel well. Just please try to call us back. It makes such a difference to us to know that we have been able to reach out to the community and, you know, take the steps to stop the spread.
Great. Thank you so much. Tom, our emergency management director.
Good morning. Yeah, I mean, everybody's already gone through what I would say. I just want to just put one thing is be aware of your surroundings. You know, why jeopardize your holidays because you didn't put a mask on? I every time I enter the grocery store, I have a mask. But with the holiday season, everyone's shopping. Just make sure every shop is crowded. Put that mask on. You know, I think you'd be much safer and hopefully healthy for your holidays. That's all I have.
And I think that the other thing with the holidays is you are changing your bubble, probably. You're changing the group of people you've been with who you know that they're all vaccinated and you know what's going on. So I think that's really to be aware. I think Laurel said be aware of your surroundings and how that happens. I just can't thank this whole team enough for all the great job that you do every day. Great point about the Wakefield Police. They are fabulous. And I'm so happy that we have a community that invests in the police department and has these officers in the schools working with the younger community. Jen, did you have anything to add before we sign off?
I just want to let everybody know about Monday's clinic at Memorial Hall in Melrose. It is a booster clinic only. It's right, if you're not familiar with Memorial Hall, it is right over the Melrose Wakefield line, right near City Hall on Main Street. There's parking. It's pretty easy to get to. We were just informed, they looked up the numbers and the Pfizer appointments are fully booked, but Moderna is available. So you can head to wakefield.ma.us/booster2021 or just go to our homepage. There's a big box with an image you can click on to get the sign up links. I think some members of the team here are going to be over early in the morning, and you might see them too. And also a big thanks. My 2 children were among those at the youth clinic, and it was incredibly efficient. We were in and out of there, and the staff was wonderful. So personal thanks from me.
Were you the kids that took all the candy when they left? Was that?
Probably, yeah. They probably took it when they came in and when they left.
Beautiful. No, it was great. And Laurel, did you have?
Yep. I don't know how to put my hand down. So one, Jennifer, thank you so much for your PR on all of this stuff. It's been amazing. And then the other is that though vaccine appointments are generally a suggestion, especially first thing in the morning, we can get a very compressed event. So we're really asking people, especially in the first half of the day, to honor those appointment times that you have, within 15 minutes or so, because we will be in at 5 a.m. preparing vaccine. We have got the timing of, especially the Pfizer, down to a well-oiled machine, but it takes time, and it cannot be done ahead of time, and it cannot be done instantly. So if you're early, don't be surprised if we ask you to wait in your car until your time or go grab a coffee, but we'll try to have candy as well. Just saying.
Great. No, I am really happy that we're able to do these clinics and help the community fight this. We're all in this fight together. So good luck on Monday. I may come over, but I promise, as Laurel knows, I don't wander around and cause any problems. Give me a job, I stay and do it. So yes, you may see me on Monday. Just great job, everybody. And please, the information is on our website. Sign up and get that booster. It's really probably the best Christmas gift you can get and give. So thank you. Anybody else?
Steve, could I just chime in? There are slightly more than 200 Moderna doses left. And you can, even if you had Pfizer for your first your first COVID series of shots, you can switch over and get a Moderna.
Right.
There have been a number of clinics out there recently, but they fill up very quickly, and ours is no exception. We're doing almost 2,000 shots on Monday.
That's incredible. A huge number. And also, if you got a J&J on the first time, you can get Moderna or Pfizer, as I've heard. Yeah.
Yes, you can.
Right. So 200 opportunities. Maybe some of those college kids that are coming home that are going to need those when they go back. Good day to get them.
College kids only if they're over 18.
Right. Hopefully most of them are. So over 18. All right.
Pfizer
great.
can go down to 16, but Moderna is 18 and over.
All right. Perfect. Guys, great job. And any questions, contact, you can get information via our website, or heaven forbid, contact the Board of Health. On Monday, if this is out there, Monday, the Board of Health personnel will be at the clinic. So just bear in mind, there may be some delay in answering some other questions on Monday. Don't be alarmed. They've got work to do at the clinic. If there's any other issues, certainly call my office. I'm always here.
Steve, one more thing. I know you're never going to invite me back because I'm long-winded here, but if there are any vaccinators out there, we could still use additional people on our morning session, just so we can give people breaks and everything. They can just call the Department of Health at or me directly, 781-979-4129, if they want to just volunteer, or anyone on the Board of Health, and we will certainly plug you in. And I just want to say thank you to everyone out there who is volunteering their time. It's everyone who is making this clinic possible.
Absolutely. And on that, we will wish you all a Merry Christmas, and we will probably won't see you until after the new year unless something happens, because Christmas Eve and New Year's Eve will be when the show would be. So we definitely won't be here next week, and probably not until the first week of January. So be safe and be smart. And thank you, everybody, for working with us through this. Take care. Have a great day. Bye-bye.